Let's talk about symptoms, shall we? Symptoms of ectopic pregnancies tend to start occurring anywhere between 6 and 8 weeks. If you are a woman of reproductive age and you are actively trying to get pregnant, but also you may not be trying to get pregnant and you may have been on oral contraceptive pills, but you've missed a few and you've not been compliant, or you have been using barrier contraceptions like a condom and the condom may have broken, the bottom line is you are in your reproductive years and you are sexually active. If you start feeling a sudden onset of sharp pain in your pelvis, plus or minus vaginal bleeding. Now, the vaginal bleeding that tends to occur in women who have an ectopic pregnancy tends to be spotting in nature. So you won't bleed like you're having a period or as if you were having a miscarriage, but it is very often light, if at all. In cases where the ectopic pregnancy has ruptured, particularly when it occurs in the fallopian tube, you will start to bleed within the pelvic area. And the blood leaking within the pelvic area will lead to irritation of local structures, causing radiation of the pain that can be felt in your shoulder and your neck. And if you continue to bleed, and remember, that doesn't necessarily mean bleeding loads vaginally. You may be bleeding internally without even knowing. You may not have any vaginal bleeding, but you might still be bleeding internally. So if that continues to happen, you will start to lose blood volume, causing you to feel weak, dizzy, and possibly even faint. So, ladies, a sudden onset of very sharp stabbing pain in the pelvic area, often on one side of your pelvic area, is never good news. Seek medical assistance immediately.